What are biomarkers for remission? What exactly are biomarkers for remission in rheumatoid arthritis? Biomarkers are measurable biological indicators that help predict or reflect the state of disease inactivity or low disease activity. They play a crucial role in guiding treatment decisions and assessing prognosis for individuals with rheumatoid arthritis. Several key biomarkers have been identified that can indicate remission in rheumatoid arthritis. One important group is specific B-cell subsets. Research shows that higher baseline levels of transitional B cells and CD21 negative PD-1 positive B cells measured at diagnosis are significantly associated with achieving remission within 24 weeks. These B-cell populations have demonstrated high specificity of about 86% and moderate sensitivity of around 59% for remission, regardless of the treatment type. This means that immune profiling of B cells at diagnosis could help identify patients who are more likely to respond well to standard therapies. Another set of biomarkers involves cytokine signatures. Cytokines are proteins involved in inflammation. Certain cytokines, such as interleukin-6, tumor necrosis factor alpha, and interleukin-12p70, have been studied as potential biomarkers for remission. Lower levels or specific patterns of these cytokines correlate with remission status. Models that combine these cytokines show high predictive power for clinical remission, with sensitivity and specificity around 87 to 89%. Helper T cell-related markers also play a role. A subgroup of helper T cells known as peripheral helper T cells produces a cytokine called IgFL2. Blood levels of IgFL2 correlate strongly with disease activity and severity, suggesting its potential as a biomarker for monitoring remission or active disease. While traditional serological markers like rheumatoid factor and anti-cyclic citrullinated peptide antibodies are commonly used in diagnosing and predicting rheumatoid arthritis, they are less reliable for defining remission. This is especially true for seronegative rheumatoid arthritis patients who may lack these antibodies but still experience symptoms. In clinical practice, remission in rheumatoid arthritis is often defined using composite disease activity scores, such as the Clinical Disease Activity Index, with a specific threshold, like a score of 2.8 or lower. Biomarkers, such as B-cell subsets and cytokine profiles, can complement these clinical measures by providing objective biological evidence of remission or predicting which patients will achieve it. Overall, integrating immune cell profiling and cytokine measurement represents a promising approach to identifying biomarkers for remission in rheumatoid arthritis. These biomarkers can support personalized treatment strategies by predicting treatment responses and monitoring disease status. However, it is important to note that many of these findings are still emerging and requiring validation in larger patient cohorts before they can be used routinely in clinical practice. Patients with rheumatoid arthritis should continue to seek personalized care from healthcare professionals. Remission assessment relies on a combination of clinical evaluation and biomarker data tailored to individual cases.